Welcome back to Wicked Spine Show. I'm here with Dr. Dadian at his Phoenix Physical Therapy office in Rancho. He has an office here and in Glendale. Today we want to talk about why do people come in my office as a chiropractor, they're frustrated with a physical therapist. They don't get the right care. They're not the right information they need. They can do all stuff at home, right? I'm here to help you understand Dr. Dadian, his staff, and what he does in his clinics. This is why they're growing. This is why they help a lot of people in their community and why they're helpful. So Dr. Dadian, let's go over exactly what you do here and why are you, and this is what I want to get into, a physical therapist is one thing, but why do you become a doctor of physical therapy? Why is that important to you?
Good morning, everyone. The physical therapy is a huge major nowadays. We have actually 7 specialties in different ways. I mean, you can get a specialty either in ortho, sport injuries, or geriatrics, pediatrics, cardiopulmonary. My specialty is in musculoskeletal disorders, or MSKs, we call it MSK. So we usually provide the service for, those people got injured with accident or other injury. So we provide a good service to the patients. My career starting when I decided to treat my knee after injury I had at high school. When I went to physical therapy for first time, I didn't know, I didn't have any ideas what's going to happen next. So the doctor told me you need a surgery, but my physical therapist said at this point you have to start with physical therapy to get the range of motion down first and get the strength back on the knee, and then moving forward, and then if you need a surgery in future, then the ortho doctor can do a surgery for you.
Good.
When I started with my physical therapist, after a few weeks, I saw I love this measure, so it works a lot for me. And then I got better. I got much better, and then I changed my mind. I didn't go through the surgery at that point, so I decided to go to this measure. And then when I started education, I got my bachelor degrees back those days and master, and then eventually the DPT program came up. As a doctor of physical therapy is a clinical actually level of education in our major. So then I decided to go back to a school, and I went to Chapman University, and I graduated there with this actually degree.
That's a lot of schooling.
Yes, doctor.
I like that. I get done with school and get to work. That's all I want to do. And with Doctor Physical Therapy, how does that promote you in your, expansion of what you can do treatment-wise, but also with everything else you do now?
First of all, the DPT program give you different point of view in terms of physical therapy, because a lot of times we just think about the MSK pain and then we say, okay, it's a biomechanics problem. But sometimes the pain comes from internal organs, and we have to, just screen the patient, see if this patient is in our field, or we have to refer the patients to the other specialties. As a result, the DPT gives you this opportunity to do a good screen for the patients and make a good clinical decision for the patients. Basically, it gives you more knowledge about the patient's situation, so you can pick your patients with the knowledge that you have.
What I like about that, like what we do too as chiropractors, they may have a shoulder problem, but is it coming from the shoulder? As a physical therapist, what I've understood is I'm getting a script from a doctor saying treat the shoulder. Boom, that's it. As what you're doing as a doctor of physical therapy, now you can go, okay, maybe it's not the shoulder, maybe it's the neck, maybe it's the upper back, maybe it's the arm itself too. How do we look at the whole person's whole being, not just the area where it's actually painful?
So when I was at this school, one of the professor told me you have to screen the whole joints. You don't need to just do examination for the shoulder, for example.
Good.
In terms of MSK pain, sometimes the pain, as you said, comes from the neck to the shoulder. And sometimes the pain is totally internal, comes from gallbladder to the shoulder, for example. So you have to be able to say, okay, this pain is musculoskeletal, is related to the shoulder, or either neck, or the other side of the body. So when I see the patient, I'm starting to do evaluation from the neck to the bottom, to the feet. Because sometimes you have a pain in the lower back pain, but the pain is not related to the back by itself. The back got involved because, for example, we have a inversion on the calcaneus bone, so we have to solve the problem with the insole shoes. Put the insole in the side of shoes or wedge. So you have to consider every aspect of the,
It's almost the mechanics doesn't come from one joint. For me to understand it, it comes from several joints that work together.
That's true.
And the biomechanics of the joints working together or not working together properly allows one area to become your first source of pain. But if you don't take care of that, then the second source, third source, it becomes a domino effect for one too. How did you become an expert in your field, Doc? What over time gave you that expertise?
So by practicing and see the different type of patients and studying about it. If I don't know something about the patient, I go and get the articles, get a book again, study about the case, and then the other day I come do examination again. And so as a result, studying and constant and studying and practicing.
Well, a lot of it is too, when I talk to my interns, it's education, yes, through schooling, and again, you did more schooling than I would ever think of, but also too, being in practice, seeing people, asking questions, having good mentors, continue learning. It's amazing how most doctors, maybe any type of healthcare practitioner, they stop learning thinking they know everything.
No, that's not true.
Things are changing, but as people, for example, with COVID, people sat more. Now type of injuries are more prevalent. Now we have to deal with physical, mental, emotional, how they're overall affected. With COVID, the last couple of years, this being right now, January 2023, how is your practices changing this period of time?
Actually, we got so slow. We were closed for 2 months almost here at this location, and then after that, we decided to open the business with all precautions and all of guidelines, and everything went well. Thank God, we didn't have any specific issue, and then patients were happy. We were happy. I did some telehealth care for the patients, but honestly, I like to see the patients in person, physically. I don't want to, do some, telehealth or whatever. It works sometimes, but, not all the time.
Well, it's funny. I had a doctor appointment because I had a sore throat. And doctor asked me on telehealth, how do you have yellow spots in your throat? I'm like, sure I do.
Sure I do.
I don't know. But it's something to where when you're with someone, you can test their joints, see how their body reacts to the testing you do with them, see how their facial expressions are, so you see if they're really in pain and what's going on with the person in general, so it's more personal, I think. Phenomenal. Good. And now that you've reopened up, everything's are back to normal, why a second clinic? Why Glendale, not just Rancho?
Because Glendale, actually, that was a place I was thinking about it since 5 years ago when I moved to Glendale to live there. And then as a result, I decided to open another location in Glendale. So then we opened the location last year, exactly this time, January 2022.
Fantastic.
And then we were slow, but after 2-3 weeks, we picked up slowly, and now we are growing there. So I'm happy that we opened another location, so it gives me more opportunity to see different volume of patients and help people more than here.
Well, it's a lot of work because now you have 2 staff, you have 2 offices, people that are just people in general. How do you manage all those people at one time?
Honestly, we have a good office manager that manage both locations for us. And then since we have 2 different volume of patients, so we have to manage each office separately.
Good.
But our manager has a good knowledge to manage both locations different ways. So that's a key for our,
It's amazing you're able to, and some doctors can't, give away that control. Hey, I trust you enough, just run everything.
That's true.
It makes our job as doctors easier. We don't have to worry about, is the building going to go out? Is electricity bill paid? Now with gasoline or heating bill, why is it 3 times as much? What the heck's going on? We don't worry about that stuff. We just see people.
Yeah.
Makes it easy.
That's the thing I wanted. You wanted.
Yeah, to see people. I guess that gives you the quality of care. Why do people come to your clinics? Just in general, why do people come both to your clinics?
First of all, the people get a result. So when they come to us, they get a result in a short period. That's the thing we can provide to the patients. Because I don't like to drag the patients. I would like to get the result as soon as possible if I can provide something to the patient. And we provide different types of, interventions that the patient needs. Based on the patient needs, we try to, manage the patient care. And basically, I believe the biomechanics, I believe to exercise therapy. My focus is on that. And also kind of manual therapy, doing myofascial release, joint mobilization, so whatever patient needs. And when the patient gets better and see how we try to help them, they provide information to other patients and recommend us to the other one. So
there's it's been around for 1,000 years. The best referral for any business is a personal referral.
I agree.
It's me telling Johnny, hey, look, they're great people, go see them. First, you can go to Yelp, Google, websites, whatever it is too. But once you get a personal referral and you get that, if you want to call it competency with your patients, you give them hope for one, you help that person, and that person becomes a voice in the community to help other people get the same type of care. Because as you know, there's different physical therapists, different chiropractors in the area. It's sometimes the person that they want to see, not just the profession.
I agree. I totally agree with this opinion. The best kind of referral is just, recommendation by person instead of, getting information from Yelp or other. That
It's
helps.
good. It's helpful.
But it's not a direct thing to get the best thing that you need.
No.
Not just for the medical field, for everything, basically.
And I just did a walkthrough with Dr. Dadian with his office too. He has a lot of therapies here and some staff that helps you really walk through everything. Talk me through what therapies do you offer here in also in Rancho and in Glendale?
So we offer actually independent contractor job to them because
Awesome.
we are a small company. We can provide the
Good.
benefits, but
Good.
they are happy in terms of rate. So they would like to stay with us because the rate is sufficient for them, and then they help the patients, and that's the thing we love it. So we are working together to make a good job here, and then provide a good, excellent service for our community.
And specifically, what do you offer here as a rehab in Rancho?
As a rehab, basically, we see different volume of patients. My partner and colleague has a specialty in neuro, and
Good.
he has been working in Loma Linda Hospital for Parkinson patients more than 10 years.
He has experience.
So as experience, we provide a good service for Parkinson disease patients also, MS
Awesome.
patients. And my specialty is basically ortho and spine, working on that. So we provide all the services patient need based on the diagnosis and based on the need at this office. We have everything. We have traction table, we have massage table, we have actually modalities, we have laser in both locations, high power laser to remove the inflammation fast. So
That's what I like is that you offer all the therapies that get someone to start the care. Inflammation is huge with pain. So if we get the pain down, then we can start moving more to get things to rehab faster and quicker, not a waiting period for one too. And with that, the therapies you do, how do people come through with insurance, with work accidents, with personal injury? What do you usually see in your clinics? What's your
So
demographics?
actually, fortunately or unfortunately, I don't
Yes.
know, we have different volume of cases. We see PI cases in high volume,
Awesome.
work cases in high volume, Medicare patients, and insurance, commercial
Regular insurance,
insurances like Blue Shield, Cigna. We accept, the commercial insurances, some of it. So for me, there is no difference between Medicare patients or PI cases or work comp because I do my best. So I
Yes.
provide the same service for all of them. As a result, we can see different volume of patients. Some clinics just say, okay, my design doesn't let me to see, for example, work comp. I see just PI. I see insurances. So I'm happy to tell you guys, we see different patients with different injuries, with different insurances and different situations.
It doesn't matter.
It doesn't matter. We can do a great job for them. So.
No, that's the front desk stuff. That's your good office manager. That's her job to bill it out and figure things out too. And with that too, with seeing people, and you said you see cash patients also pay out of pocket. What kind of compliance do you see a cash patients versus insurance versus work comp versus accident case? What kind of compliance do you see where they follow through with care? They come in, they're asked to come in. They see the overall results from your treatment.
Honestly, when the patient pays from the pocket, they want to get better sooner. I mean, all the patients want to get better sooner, but they think about the money also. So as a result, we get the result a little bit faster than the other volumes. But on the other side, the type of treatment we provide for the cash patient is not different from Medicare patients. So we try to do our best, but the patient feels better because when you count on your money, so you try to do your best. You get your part at home. So usually I give the patients home exercises the first day of the evaluation. I say, this is your part and your participation is important for me. I need a consistency with all exercises 3 times a day like a meals. Like breakfast, like lunch, like dinner. I need you to participate actively. As a result, we see the difference in second visit, in third visits.
It's almost when you pay attention.
That's it.
And by doing that, you're going to see results faster. You're going to learn how to take care of yourself at home too, so your overall body can stay healthy even when you stop the care if you do. So make sure your body, and when you have a problem, you know how to treat that. I call it being your own best doctor. How to treat your body better. Comes down to okay. We all have injuries. We all gonna have problems from one too. We all work in the yard and we climb the ladder, especially during Christmas, and we fall. We hurt ourselves. All right? So we want to make sure we understand where to go, how to find competent people to help you right away. And with his 2 clinics and with his staff especially, they have a lot of staff here, They can get you in and out right away. There's no waiting period for one, too. And you don't need a referral. Again, this is a DPT, a doctor of physical therapy, can see you right away with his other staff to help you with not only physical injuries, Parkinson's, what else is there? MS.
Multiple sclerosis.
And multiple sclerosis, other things like that too that are neurological, not just biomechanical or muscle or soft tissue based too. And with what you're doing right now, how do you want to grow your businesses in Rancho and Glendale? What's your future look like?
My goal in Rancho, actually, because it's a huge city, and I see this city is growing fast.
Yes.
And I like the population here. Honestly, I like the population of the Rancho.
Good.
Because people working hard to make the life easier for the family. So I would love to help them. My goal is to grow up with the people here and then provide excellent service in a huge clinic. I'm looking forward to get the huge clinic here. Hopefully,
We have a huge clinic already.
Yeah, already.
You
have
have,
a huge
how many
clinic,
treatments do you have here?
how many years?
Treatment rooms.
Treatment rooms. How many treatment rooms we have here? 7 treatment rooms, including one room for traction. So basically,
I don't even have that much.
yeah, and then we have a good, sufficient gym here.
Whew, I saw that.
Yeah.
You guys are set up.
Yeah.
It's easy. And with what's going on too, and going back to our overall topic, what would you say if someone is not in your area, how should they pick a physical therapist? Or get physical therapy? What would you recommend?
I would recommend just get the information from the people you know. For example, if you have a friend and then you used to go to physical therapy, ask which place was good and you got a result there. So
Good.
I don't go to Google. Usually I don't Google for those stuff. I try to get the information from my friends, family members, or for dentists, for example, I ask my sister, okay, where do you go? How was the result? So then I pick the dentist for myself too. So the same thing with physical therapy. You have to trust the people you're gonna go to get a service. So that's my,
And I usually tell them too, if someone referred me somewhere I don't like them, I blame them.
Yeah.
I go, what do you tell me that for? Well, that's a lot of it is when we talk about personal referral, we talked about before the show started too. That has been around for thousands of years. Rancho, even though it's a big city, it's still a small town feel.
Yeah, I agree.
Along with Upland, where I work too, and where I live also, when you're a local person, you want to see local people.
That's true.
So if you're in Rancho, Ontario, Upland, even Claremont, or God forbid, Fontana, which is 10 miles away, which seems not that far, you have somewhere to go to get the carry open 5 days a week or 6 days a week, or how many days a week?
5 days.
Perfect. Good. You can come in whenever you want to come in. They'll take care of you, and that's what it comes down to. Anything else to end the show, Mr. Dr. Dadian?
That would be all. Thank you, Doctor.
All right.
Nice meeting you today.
You're welcome.
Happy
Thanks
to
for
have you
coming
in
in.
our office today.
It was fun. One more smile for the picture, and we're good to go. Thanks for watching, guys. And in the show notes, we have all his links to his website, Facebook, Instagram, and also his phone numbers to his Glendale and Rancho clinics. Again, they take all the insurances, work injuries, accident case, obviously, and you can bring in dead president dollar bills in there if you want to too. Cash, they'll take that too. Thanks for watching, guys.
Thank you.